a 60-year-old man, spontaneous muscle hematomas and persistent oozing, prolonged PTT, mixing fails to correct the PTT, actively bleeding. What is the most appropriate initial management? So here we see a male hematomas and prolonged PTT, which is a hemophilia case. And it's always a man or a boy because it's X-linked. And intramuscular hematomas and hemarthrosis are classic symptoms. Also in the previous video, we talked about a very important complication of hemophilia, which is hemophilic arthropathy. We all know that hemophilia occurs due to deficiency of factor 8 in type A or factor 9 in type B, and both belong to the intrinsic pathway. You don't need to know all of that, just use the way by which we remember the factors, by using factor 10. And we say that 10 is multiplied by 5, 2, and 1. So those are the common pathway. Then remember that factor 7 is in the extrinsic pathway, so anything else is in the intrinsic one. That makes it easy and only takes a second. Then you need to never mix between the PT and PTT. So we can use the first aid mnemonic, which says that we play table tennis inside. So table tennis is the TT, and inside means intrinsic. So the PTT tests the intrinsic pathway. So back to the case, the patient has hemophilia, actively bleeding, and the plasma doesn't correct with a mixing study. So this is due to inhibitor development, which occurs in 25% of patients as a complication of treatment, because the immune system recognizes the infused factor as foreign, forming antibodies that attack it. So how do we treat it? Choice C, recombinant factor 7. Remember that all these factors work to activate factor 10. So factor 10 is the core. And here's our problem in hemophilia A, which by the way we cannot solve. So we activate the other pathway, which directly activates factor 10. And here are our side notes, which I recommend you to read.